Uh, I had my transesophageal echo today, and it went fine. And I won't know the results for a little while, but I was told that if the answer is no, that they can't repair the valve from what they see, then that's probably true. But if the answer is yes, they think they might be able to repair it, then that means possibly. And they won't know for 100% sure until they're inside my chest in open heart surgery. But it would really be nice to get the word that they think they can fix it. That's what I'm hoping to hear. And I, since I had the transesophageal echocardiogram where they put a camera down your esophagus to get better pictures of the heart, I received a sedative and anesthetic that I had to gargle and swallow to numb my throat so they could put the thing down there, and a sedative to pretty much knock me out so that I wouldn't freak out when they were sticking the tube down my throat, basically, you know, or bite down on it or anything like that. So my point is that I'm slowly, coming down's not really the right, maybe I'm coming up from the sedative, and it's been nice and relaxing for the last couple hours, and I've experienced this. I've only been sedated a couple of times, really, just this test and the TE last year, and last week for the cardiac catheterization. Not last year, 3 years ago when I had the TE, the same test, and then last week I had the cardiac catheterization, where I guess they did give me some sedatives, but it was different. And they weren't putting anything down my throat. They were just putting a catheter in my groin. And anyway, my point is that the other time, it's not really a sedative, I guess, but when I broke my thumb years ago, like 1996, I was given codeine for that. I had a lot of pain and had to do some physical therapy, but I remember a really nice sleeping better than I had in a long time, and feeling really clear, you know, for a couple days, or however long I took the codeine, or a couple days after every time I took it, whatever. It's been a long time, but so anyway, I really have avoided any kind of anti-anxiety drugs or anything like that. I guess I'm interested in finding out more about it because I mean, it just depends on the side effects, what's in the crap. I didn't want to use artificial methods to relax, but I think because of a combination really of trauma, you know, repeated traumas in my life, emotional, physical, and high intelligence and a very active mind. Yeah, it's getting to the point where I don't know. I mean, I'm willing to consider taking something, possibly, if there's not a bunch of side effects and or long-term problems with it, and if it doesn't, I don't want to be flatlined. I don't want to be emotionally, you know, insensitive or unresponsive or whatever. I just want to have the edge taken off a little bit. Not be not be in fight or flight mode, you know, like almost all the time, and have it affect interactions with people and relationships and everything, intimacy, all that stuff. So anyway, not going to analyze too much more because I'm just enjoying the pleasant tiredness of the last lingering effects, I guess, of the sedative, and you know, I mean, it was nice to, not that it's nice particularly nice to go to the hospital in general, but it's nice to feel cared for, you know, to have people doing these tests. And, you know, I joked and visited, and it's nice to get some care and feel that people give a crap. And hopefully I will get some good news. I really, really hope they can repair this valve. I really don't want an artificial valve and to have to take blood thinners the rest of my life. And I'd rather not have to, or I'd rather not choose to have a pig's valve replacement, which would not require blood thinners as far as I know, but wouldn't last as long as the artificial valve. So last I heard, it's something like 6, 7, 8 years or so, where basically it would wear out and they'd have to go in there and do it again. So I'm not super excited about that. The ideal solution, and what I hope for, is that I have a monitor plugged into my laptop because my laptop screen's broken. That's why I don't always look at the camera. But yeah, it would be really nice to be able to get my existing mitral valve repaired and get many, many more years of good service from it without the leakage, without the fatigue, lightheadedness, shortness of breath. And hopefully, ideally, that repair would last forever and I'd just live out the rest of my life. And even if, you know, 10, 15, 20 years from now, if they needed to fix it again, fine, you know. But so I'm really hoping that I can keep my existing valve and have it be repaired, but it's really out of my hands. It's not up to me. It's up to what the surgeon thinks, or whoever assesses these tests, which I assume will include the surgeon that's scheduled to do my surgery whenever it's actually scheduled. So it's going to be his determination from whatever data he gets and whatever pictures he gets from today's test to make a decision on whether he thinks he can repair it or not. And I hope so. And then if not, I guess, I mean, I can try to argue, but I guess it's probably not going to do a lot of good. I'll try. If it's inconclusive, or it's, you know, I assume there's a spectrum from there's no way we can repair this to we can definitely repair this, and there's all degrees in between. So if it's in any way possible to try to repair it, I'm going to try to push for that and ask him to try it. And then I assume if they get in there and they're attempting to repair it, and then, you know, if they decide that they can't, then they can go ahead and put the artificial valve in. Alright, point is, I'm relatively relaxed today and mellow because of the sedatives, and it's kind of nice. You know, talking about this is a little stressful, but for the most part, this afternoon and evening, since I got home, I've been pretty mellow. Kind of be a nice time to cuddle with a woman or something, because I'm pretty relaxed. I really think that's what gets in my way of so many things, just that fight or flight, anxiety, hypervigilance, whatever, plus, you know, the being the thinker that I am. So it's interesting. You know, I have to try to find out what they gave me today and see what the chances are of getting some more. I don't know. Okay, signing off.